You talked a lot about some of the inconsistencies and the challenges that you experienced trying to establish a sustainable active ingredient business in Ghana. You're listening to African governments right now. There is a lot of political momentum. We are going to do this. We're going to go and make vaccines and become self-reliant. When you listen to those conversations, what worries you about the way they are looking at this, and what do they need to get right?
What worries me is that the pandemic is already fading away and it's going to be over and that's it. And nothing is going to happen. That bothers me. There's a lot of talk. They're saying the same things that they said 10 years ago. We've been here before.
Yes.
And nothing has moved forward. I was very encouraged a couple of years ago. Someone at HHS got in touch with me to say, hey, you know what, Merck is setting up a vaccine facility in Ghana. I'm not sure that has happened. It's been like 3 years or something. I don't know what's happened with that. But there is a lot of, and believe me, I think that is just inherent with governments everywhere. Yes. Because in the 2 years that I worked with the US government, they're very slow, okay? Yes, when a pandemic happens like this, everybody puts their hands on deck.
Yes.
But when it comes to making change, it's a little bit at a time. And the biggest worry I have, and I have seen with African governments, and it's particularly in Ghana, is that one government starts something, a political party that is in government starts something, and once they leave, the next one comes in and it's stopped. So there is no continuity. There isn't a plan that you say, we've been talking about this pharmaceutical manufacturing plan for Africa for ages now.
Yes.
There isn't a plan that you can see this has been adopted and that this government is going to follow it through for the next 20 years.
Yes.
Because it will only last as long as the 4 years that particular government that adopted it has done it. That's what I've seen. So that bothers me. I have seen a lot of investments, though, in South Africa. South Africa has invested quite a bit in, technology, in all sorts of things. And that's why I say that they should come together, as the African Union and look at who's good in this, who's good in that, come up with a plan that is a universal plan for the continent.
Yes.
And implement it. Let each government take what they feel, this is the one I want to promote and go with it, but take a plan. So that bothers me more than anything else. And the other thing is, of course, the investment in healthcare has just not happened.
Yes.
The investment in R&D has just not happened. I'm no longer begging for the R&D. What was it? They said 1% or so they should invest. Nothing has happened. It's just not there. So we keep playing catch up, and we can never catch up if we continue the way we're going. There are certain things, I have to tell you this, because of all the work that was done. I remember sitting at meetings that I had when I was working with HIV at PEPFAR, and there were a lot of developments that were done that are being used today with the COVID. The telemedicine and all of those things that the US never wanted to even think about was being implemented as helping other nations, developing nations, India, Kenya, whatever. You got doctors, you could get surgeries done, wearable things where you could look at, get your blood pressure and everything, and it goes to the doctor and the doctor sees it and so on. A lot of that work was developed as part of helping the developed nations. And so all that needed to be done was COVID hit and they pulled it up, and we now see, hey, everybody's on Zoom, people are doing all sorts, doctors here. My daughter is an orthopedic surgeon. I tell her, how are you going to cut up the bones? But she still sees her patients on some of these platforms that they have. So there's a lot that has been done. especially with the youth that we have that are so much into IT and so on. We need to harness all of that, because you can't talk of healthcare now without talking about our IT infrastructure. It's very important. Counterfeit medicines, how to combat them. We don't even want to go there, but that is a major part of wanting to have our manufacturing done in Africa, is to try and help with that counterfeiting. That is a big deal.
Yes, really very, very critical, all of those aspects.